Dr. Wayne Kuang here from Man vs. Prostate, and I just wanted to take the time to say thank you for all that you are and all that you've done this year as defenders of the detruser, as you have embraced that simple truth. Along with the brain, the bladder is the only other major organ that cannot be transplanted, so we must take care of it. And this year was really special. Initially, it was just a small little spark, and now we have a flame that is strong. And now together we can help grow it to provide a BPH BPO care pathway that is simple, safe, effective, efficient, and personalized, that meets as many of the needs and wants of all of the parties at the table of shared decision making, which includes the patient, the provider, the healthcare system, and of course, the bladder. 2025 was a very special year. This campaign started in 2022 in January. And since then, we've been building slowly with the help of all of you, because it does take a village for us to have an evidence-based care pathway that we can establish together. This year, we really helped prioritize and bring the bladder into the spotlight. We talked about bladder span, the number of years lived with optimal detruser function. We talked about the 5 stages of bladder health, right? Benign prostatic obstruction, OAB, urgency incontinence, retention, as well as bladder failure as a communication tool that's community-based and patient-facing. Obviously, it's not perfect. Transitions are not distinct. Stages can be skipped and stages can coexist, but it allows us to have a linguistic framework with which we can talk to each other and talk to our patients and allow our patients to self-ignite, to take action because they prioritize their bladder health. We talked about the triangle of triage, helping us identify those patients who have bladders that are at risk for dysfunction. When we use the criteria such as Stage 3 urgency incontinence, Stage 4 retention, IPSS or IBPSS 8 and above alone, or in combination with slow flow, high residual, thickened bladder, or unacceptable risk on bphtool.com. We've started talking how these patients with bladders at risk need bladder health baselines with a minimum of cystoscopy. And then we also introduced the duality of deobstruction, that we all need tools in our tool belts that can provide a fractional approach as well as a maximal approach to deobstruction. Those tools will be different based on whether you're in a lower or a higher income healthcare system, but we do need to have those tools so that we can meet the needs as best as possible of the patient healthcare system, and of course, the bladder. We were able to achieve a recognized voice this year, which was really special. Together, we got our manifesto and our key thoughts put together with our book on Amazon. And it's really galvanized us and been a conversation point for not only ourselves, but also for our patients. Big shout out to the 15 of you that have now written reviews, and as well as primary care docs. And that is really, really special because now we're starting to share the word that bladder health matters. We were also able to get out our first peer-reviewed publication in Current Urology. Special thanks to that journal, as well as the editors, Christian Wettauer, as well as David Campobasso. Special thanks to those co-authors, Luca Cindolo, of course, Bilal Chagtai, and Tarek Al-Saudi. Then this year, creating the IBPSS, and you all have seen it, single page, having bladder in the title. And now we've taken the IPSS questions, kept them identical, and just reordered them so that we now have voiding subscore stage 1 BPO, storage subscore stage 2 OAB, and then we added 2 questions based on the LEARN as well as the ICIQ about urgency incontinence stage 3 and stage 4 retention. We also added a question about sex. We wanted a way to ignite that conversation, which is very taboo in many cultures. So where do we go from here? I don't think it's going to be these big gestures like the book or the IBPSS. It's really going to be these micro conversations with each other, with ourselves, and with our patients about how do we incorporate this concept of bladder health so that we can come together, triage patients, and intervene at the right time, earlier within the window of curability to preserve bladder health and to prevent late-stage disease. This year, the Delphi Consensus was performed with 60 key opinion leaders from 6 continents. Special thanks to defenders like Amandine de Grave and Sam Ward from Belgium and Celeste Manfredi and Luca Cindolo from Italy. Together, they've really put together this beautiful data set, and we're excited to see that publication come out next year. As we look to 2026, using the BPH 360 podcast, hopefully we can go straight to our patients so they can come to you pre-educated, understanding that bladder health matters, and hopefully they can now also come equipped with their own IBPSS score. So we know exactly what stage they're in, they know what stage they're in, and so they are self-ignited to take action for the right reasons. Alongside, if we can get them their data about their Q max, their maximum flow rate, let's continue the conversation about bladder health screening for all men, starting at some age between 45 and 60, depending on unique factors of one's healthcare system. Q max may be the next vital sign for men. Similar to blood pressure checks or how we can screen for hypertension. Maybe IBPSS and QMAX can help us screen for men with bladders that are at risk for dysfunction. It's important that we maximize cystoscopy as a diagnostic tool. It first rules out other pathologies like strictures, bladder tumors, bladder stones. Then now it gives us a better sense of prostate shape. What does the intravesical prostatic protrusion look like? What does the degree of obstruction from lateral lobes look like? What does the degree of obstruction from anterior tissue look like? And how much elevation of the bladder neck is there? What does that prostatic urethral angle look like? Finally, what is the status of bladder health? Are there trabeculations, cellules, and diverticuli? And then also for 2026, we're excited to see, can we start to explore this concept of avoiding cystoscopy, where we can actually look functionally at outlet obstruction? And we tip our hat to defender Fabio Santana on LinkedIn, and we tip our hat to the academic European Brigade led by Defender Cornu, putting out the most recent paper about avoiding cystoscopy as a potential diagnostic tool. So some final thoughts. I just want to share with you a big thank you. We have accomplished so much this year, and now we're transitioning to next year, gathering IBPSS data for our own healthcare systems, for our own patients, starting to have all these micro conversations with ourselves, with our patients, and with our colleagues to better understand how do we now evolve forward from a prostate-first approach to a data-first, pro-diagnostic, bladder-centric paradigm so that all of our patients can live their best lives incontinence-free and catheter-free. And so for 2026, let's lean into protecting bladders because we are defenders of the detruser, and let's go save more bladders. 26. Until then, sending you all positive thoughts for a special solstice season. And once again, thank you so much for all you do. It's been a wonderful year, and 2026 is going to be even better. All right, take care.